Okay, we're live.
Coach. Good evening, everybody. And without wasting our time, we will start our first webinar on for MS Ortho and DNB students, and a great initiative by Somadeep, Arnav, and Soham. So I would like to invite our president, Dr. Chandan Pathak sir, to say a few words. Then we will hand over to Professor Ekyapal. Chandan Pathak sir. I think there is some issue. Chandanda is not there. Over to you, Ekyapal sir. We can start the meeting. Yes.
So, good evening. Chandanda is there. Please.
Yeah, Chanda. Yes. Chandan Pathak sir, please.
Actually, I'm out of my residence, so the connectivity might be poor. So please carry on. Handing over to Anand. Thank you.
Good evening, everybody. Good evening, our Honorable President of WPOA and Dynamic Secretary Rajiv. And first of all, from the outset, I must congratulate them for initiating this platform. I think this platform is one of the best ever platform for the PG. And these postgraduates, I think if any postgraduate, they follow this program, we want to make it at least at least once or twice a month, even maybe more. So that would be a great help for them for acquiring knowledge and also the practice also, and also for that will help in for their exam. And I'm in just in a planning to make a collaboration with the foreign faculties also for sharing the knowledge regarding the postgraduate courses. So I think it would be on started on next month. So this Sunday, this evening, we'll start about the preliminaries of the postgraduate courses. Can I screen?
Yes, sir, you can.
Yes. Thank you. Is it visible?
It's visible, sir. Make it in PowerPoint, yes.
Okay. So this is the orientation of the freshers. This is extremely important because once they have got chance getting the MS orthopedics, so there is a big dream which comes to a reality. So that is a great release of energies, and they are feeling. So how that's energies to be channelized. This is our job, but this is extremely important for the student also to know how to channelize their extreme energy which they gathered or to acquire this. They have become the cream of the society, and they are now becoming, within 3 to 4 years, they will become the cream of the society and the expert for imparting knowledge and practice for the orthopedic surgery. But the problem is, you have to remember, they never let the success to go to the head and take failure to the heart. This is most important. Chase the dream. We have to chase the dream, and that way by you can acquire the the aim. So you have made a extreme study to acquire this for this position. Now we are becoming the first year. Now how to plan, how to differentiate how to compartmentalize this 3 years course. Basically, 3 years course can be divided into four phases. First phase is the planning phase or the orientation phase. Basically, it is a 3 weeks period is sufficient enough. I think it's for all the freshers who are admitted either in the MS orthopedics or the DNB orthopedics. This is for the orientation. So orientation for the for the institution, orientation to the colleagues, for the new subjects, and also for the patient. It is its phase. It is the development. The next observation phase is most important. Is the next is basically we will have to observe the how to learn to to impart the knowledge by themselves. Next is the most important phase is the implementation phase, so the active phase, and this active phase is basically from 3 months after the admission and up to 6 months before the final examination. This is the most important and the most prolonged phase. And what are the problems to what are the points to be noted, and what are the steps to be followed in this phase, I shall discuss. Lastly, it is the evaluation phase or the exam phase. It is the last 6 months of the final examination. So in today's and today evening, we will discuss about the first three phases: the planning phase, developmental phase, as also the implemental or the active phase. Now the planning phase is the first 3 weeks. First 3 weeks, basically, it is an identification of the course plan. It is most important. I actually I see I watch different centers that there's no significant there is no curriculum at all. So MS orthopedic, those who are postgraduate, fresh postgraduate, very much in a very complex condition. So what is the curriculum? What are the operations to be learned about? What are the cases to be seen about? So they are very much in a complex condition. So course plan or curriculum is extremely important. I shall try to make a outline of this curriculum in this lecture, and I think that will have much benefit for the students. Next, they have to identify the place and the person, that is orientation of the institution, as also the colleagues, or as also their faculties, and also any other persons which will helpful for their patient, that is delivery, patient care delivery. Next is most important is the knowledge about the self. So you have to know how much you know, what is your residual knowledge, because every students, they actually learn their basic knowledge. I think maybe somebody maybe 3 years back, somebody maybe 4 years back, somebody maybe 5 years, somebody 10 years back. So this is important. What is the residual knowledge? If the residual knowledge is less, suppose the anatomy, if there are deficient anatomy, there is no harm to read the book of the anatomy, so that the basic steps of orthopedic surgery is anatomy, and that will help for their acquiring the knowledge of that anatomy. So this, you have to know the residual part. I'll come how to know the knowledge about the self. Now the identification of the field of interest, this is extremely important. So this field of interest can be grown by seeing the good results in the OPD, good results in the follow-up clinic, as also during the operation, and even after the operation, if the patient is absolutely becomes painless in the post-operative period, or patient is started to walk like this, that will help in development of the interest. This is the most important. We have to identify the field of interest. And lastly, the first planning phase, the first 3 weeks, we have to learn the basic orthopedic care, because you have to work in a dedicated all the fields where you are allotted, like in the triage of the trauma center, or maybe in the post-operative ward, or it may be in the OPD, or in the follow-up clinic, everywhere. So you have to work in a dedicated manner in every areas where you are allotted. Unless you dedicate yourself, otherwise it is very difficult to learn the basic orthopedic care. Now the curriculum. So curriculum, basically how to make a routine. So see, the duration of a course is basically 2 to 3 years. Why I have written 2? Because initially it was first year is considered as a house staffship period. Initially it was considered, but actually it is a 3 years period. So from the day of the day of your admission, you can start countdown how to get the knowledge. I'll show you. So it is a total 3 years should be utilized. There is no question of using the term the house staffship for the first year. Now next year is the maximum hours per week. It is a 36 hours. So we have to theory plus practical. So among all the, at least your target should be, you have to devote at least 36 hours for the theory and the practical learning. Next is the weekly. You have to make a weekly routine. We have to make a daily routine. We have to make an examination schedule and the dissertation. So these two important. These last two is the record keeping and the dissertation is extremely important. And this record keeping is extremely important not only for the medical legal purpose, but also for how to implement, how to digest the knowledge, and how to implement, how to organize your digested knowledge for the benefit of the patient. This is also important, and that will be reflected by record keeping. That is why this evening I'll keep this this lecture. There are three-folded lecture. First lecture is mine. Second lecture is to be given by our senior orthopedic surgeon, that is Professor Gigi Kaur, and he will help you to know how to record keep, how to keep the records in the OPD, in the OT, or even in the follow-up clinic, or during the ward round. And also there is a how to during the record keeping also you have to take the photograph. And I actually see actually observed in some cases that medical photography is an art. So if you don't take the flexion movement of the knee joint from the side, it is very difficult to know how much flexion range is there. So there is some dictums. So you have to learn also the art of photography. And Professor Gigi Kaur will help you to know the art of the photography. And lastly, the dissertation. It is extremely important. And now the topic of the dissertation will be discussed in final examination. It is the fourth table where there is recent advances is there, and recent advances in orthotics, prosthetics, Viva table is there. There is also another topic will be discussed about your dissertation. So, so there are several questions maybe as what is your study, why it is not a other study, what is inclusion exclusion criteria like this. So dissertation is extremely important. That is why I have kept another topic this evening, that is how to propose, how to make a proposal, for your thesis, and how to make your basic research question, and that will be delivered by your extremely knowledgeable member, Dr. Ujjwal Devnath, in the next 20 minutes. So record keeping is extremely important. Not going to detail because this will be discussed by Professor Gigi Kaur, but it is extremely important during the admission, during the classroom knowledge, during the clinical experience, at the emergency, in the OPD, reduction room, follow-up clinic, operation theater, as also in the ward. And that has to be written in the logbook. It is extremely important during your the registration for appearing in a final examination. And but not only that, this is also important for personal information khata. So previously in our time there was no logbook system, but we actually kept all the informations in our personal information khata, that I have examined today the hip case, and these findings was this. I operated this McMurray's osteotomy or the replacement osteotomy, and the case details was there. So that was a personal information khata we actually maintained, and ultimately that was converted into a logbook legally. It is that by administrators. So this is also important. This personal information, if you maintain, every person will maintain the personal information khata or book log, that is notebook, that will help you to remember that patient was operated in that way, so that so if that similar type of patient may come, they can apply the same type of patient care. Next is the document of the yearly assessment. This is also important in the follow-up clinic. Certification of the ethical committee for dissertation, yes, it is also important. And how these ethical committee permission can be undertaken, that is also an area of interest. I think Dr. Devnath will discuss about that. And lastly, the data acquired for the dissertation. This is also important. Actually, in my I plan. Actually, I am planning for serial lectures on this the dissertation, and so that for all the PG and the DNB students. Personal information khata and diary, that should be the experience of daily activities will be written in daily basis, like the OPD khata. As I have told that every student should examine at least I'm telling again, so it is 15 to 20 hip case, at least 15 to 20 hip case throughout his total period, and that has to write it. So this is the case, everything. So this is the norms. This is not the what is the by standard norms. We have to write it everything. There's a history, clinical examination. I have to take the radiograph and also the functional results, like everything to be written. So at least 15 to 20 cases of hip cases, like 15 to 20 knee cases, 15 to 20 spine cases, like this for the long case. And the short case, make a list of long short case. Accordingly, we have to chase. Well, we have to chase what are the cases may come in our OPD. So that we have to make in a target that I have to see the today that at least one hip case, at least one knee case, one shoulder case, or one maybe spine case. So thoroughly, and we have to write it down like this. So this is next one is the emergency activity diary. This is also important because nobody knows once the patient, once the student they admit in the as a fresher, they are not become the expert to impart the emergency activity. So the emergency activity, they actually see, they will see regularly some new techniques or new principles of treatment. So we have to write it down. Unless you write it down, and again at the leisure time, you have to check from their textbook or from the journals or from the internet that the cares which are imparted, whether it is by standard or not, whether it is a substandard or it is a standard care, or if there is any other better care can be given for this patient also. Everything should be in your emergency activity diary. Next one is the OT diary. This is also important. In OT day, we have to carry the OT diary, and that diary should be fulfilled with the cases. Suppose the hemiarthroplasty to be done, so we have to in the day before. So we have to check how the patient is prepared for the surgery. Like if patient may be diabetic, patient may be inflammatory arthropathy. So we have to see the patient as a whole. We have to write it down, every steps of preparation of the patient for the operation. Next is how the implants are being prescribed for this specific particular patients. So what are the implants to be kept ready during the operation? That has to be make. So if we make at least one or two cases like this, then you will never forget in the whole of your career. So in this manner, so next in the OT diary, in the OT day, we have to write in which side of the prosthesis is used. So what is the head of the prosthesis? What is the stem of the prosthesis? The size of the stem of the prosthesis? Whether it is cemented or not? Like this, everything to be write it down. And in the post-operative phase, so how the patient behaved, if it is any post-operative complications or not, how the rehabilitation was started. Suppose this arthrolysis is done over the elbow. Now, from which post-operative day patient will start mobilization, or if it is an internal fixation of the distal humerus, from which post-operative it will start mobilization. These are everything to be write it down in the OT diary, so that it will be easy for them for implementation during the patient care delivery. And next is the follow-up diary. This is also important. During the patient will come, suppose it is a 6 months follow-up, it will be 1 year follow-up, it will be 2 years follow-up. So in that case, we have to see what are the problems they are facing in the long run. So this is the area they can usually see the long-term follow-ups, long-term complications. So we have to write it down that this patient was operated 5 years back. Now the patient has a complaint of this like this. So the implant failure or implant loosening, like everything. So you have to maintain this daily activity diary. Next, knowledge about the self. So this is extremely important. So what are the knowledge is required about the self? So I already told the residual knowledge is extremely important. We have to assess yourself that what is the residual knowledge. So whether you forgot about the branches of the brachial plexus or not, whether you forgot about the branches of the radial nerve or not. If you forgot, it is no matter at all. We have to check. You have to you have to read from the anatomy book. This is extremely important. The anatomy book which you were conversant. This is basically will help you to acquire that knowledge again. And we have to make a small note, or schematic diagram, so that will help you for reproduction in your theory examination. Next, so you have to need to gather information. So from your specific textbook, from the journals, or from the internet. Now, source of acquiring knowledge, I've already told these are the source of acquiring knowledge. Now you have to gain interest. So how will you gain interest? So that can be, I already told you, by noting the the follow-up in your OPD, in the follow-up clinic, even in the post-operative phase. So in that you have to identify your field of interest. And lastly, how will you motivate? I will show how you motivate in the upcoming 3 or 4 slides. Now the developmental phase is basically it is the again 3 months. So you have to know the course and the institution. You have to know yourself, the residual knowledge, interest, and the motivation. You have to identify the field of interest. Everything is discussed just now, and identify the topic of the dissertation, and that it will be discussed in the next lecture. Now, the development is identification of, we have to identify the must know area of knowledge. It is extremely important, and that can be helped, that it is helped by your colleagues, it may be helped by your faculties and also teachers and also the guides. And so you have to know the must know the area of your orthopedic field. And but there are also may know and obligatory know. Once you fulfilled your must know field, then you can go to the may know, the obligatory to know, like this. And there are several resources I already told, like the textbook, journal, the resource persons, institution, conference, and the center of excellence, like that. And we have to make an arbitrary routine that we have to read books from this area. We have to read journals at least once a week. And if it is there is insufficient knowledge, then we can ask the other persons, like that. Now, the implementation phase. So there is a clinical learning by actual conduction of the seminar, journal club, clinical classes, operative follow-up clinic, fracture clinic, and other special clinic. Again, in those areas, we have to reevaluate of your course and also reevaluate of yourself, and whether you are deficient in some areas, that has to be fulfilled immediately. Now, the clinical learning is possible in the bedside clinic during this ward round, and the word teaching, or the word course, or class clinic. So if it is a case method, that may be the case study. You can be, suppose you can start with your specific case study, which are of your point of interest from your OPD. So in that case, suppose you are having interest on the osteoporosis. So in that case, in osteoporosis, all the cases of osteoporosis, those who are attending in the OPD, that can be picked up by you. And you have to write it down. This is the osteoporotic fracture of the distal radius, this osteoporotic fracture of the proximal humerus, like that. So in your daily diary, you can write it down like this. Case analysis, if there is some complicated case, then we have to start to analysis of the case. Suppose it's a low back pain. Suppose there is a chronic low back pain. So it is very difficult to understand. So what is how to make it a diagnosis of the low back pain. So it is very easy to, so you have to take the help of your peers, to take the help of your teachers, like that. So you can read from your textbook, from the Google, like that. So suppose it's the chronic low back pain. It's easy to differentiate into the three broad categories, like whether it is a mechanical low back pain, whether it is an inflammatory low back pain, or it is an infective neoplastic. By simple asking two questions, even in a very, very busy OPD, like what is the aggravating factor and what is the relieving factor. If there is the aggravating factor is the activity, and the rest relief pain, that pain is basically a mechanical pain. Whether it is an inflammatory pain, it is aggravated after rest, after taking the rest, and is relieved by the activity. Whereas if it is due to infection or due to malignant neoplasm or any neoplasm inside that spine or anything, anywhere else, so that causes the relentless pain. There will be the activity may increase the pain, but there will be no relief of the pain. So in this way, you have to you have to know the art of analysis of any complicated case, like that. So case incident technique is also another technique. I'm not going into detail. There's a group discussion. If you want, you can make a discussion at your leisure time, even in the emergency period when the patients are not coming. You are waiting for the patients in the triage. You can discuss with your friends by personally or through the mobile. So there is a brainstorming method. This is another important technique. That is, suppose you have find some specific informative case or specific informative sign or some specific complication. So you can pick it up. You can write it down in your daily diary, and we have to take the specific radiograph and the clinical photo, the snapshots in your mobile. So that is why you can maintain this record, and that has to be discussed with your friends. And this group discussion with the brainstorming method is extremely important to remember, and that will initiate the spark of fire of knowledge, so that anybody, if it is gets interested, they can again they will ponder the knowledge to the internet or anywhere. Now, discussion technique Discussion technique can be learned from the conference, from the symposium, from the panel discussion, from the guest lecture, as also from the group discussion, as group discussion with your peers, as also or during the case presentation during your word round. This is also important. So you have to we will try to present the case during your word round to your visiting, so that will help in your discussion technique. Now, re-evaluation of the course, it is extremely important. The estimation of the extent of the covered and the uncovered area. So suppose at the end of the 4 or 5 months. So suppose some cases is not discussed till that day. So in that case, you have to list it down that suppose this case, I have not seen this case till now. So then in that case, you have to give the information to all of your colleagues, so that if this has come, they will inform. They will make a notice, they will come in a group discussion. So in this way, you have to cover your uncovered area. We can fulfill your uncovered area of knowledge and experience. Now, inquire about the uncovered area of syllabus. It is also important. And development of the skills. And I will discuss how to develop into skills like knowledge, attitude, and the psychomotor skill. Now, how to improve the knowledge? We have to prepare. We have to prepare the knowledge from the books, journals, everything. We have to present. Presentation is extremely presentation in front of the peers, in front of your faculties during the word round, during the OPDs, during the OTs. We have to present. So we have to try to present the case as much as possible, as much as in a summarized manner. We have to try to present this. Now, comparison of the association and the integration, generalization, we have to how to apply. So see, the preparation is required for presentation, and how to associate your knowledge. And the new idea, we have to go in the association of the knowledge, and from the association of the knowledge, we have to make a new idea, and that has to apply during your OPD, during your follow-up clinic, during the OT, and again we have to recapitulate. Once you write it down in your daily activity diary, that has to be help you for recapitulation. Now, how to attitude. It is what is attitude? It is a tendency or the predisposition to act in a particular direction to a thing, person, or the event. The individual should have the proper attitude towards the self, towards the subject. Whether self means, it is also important. I know some students, they consider once they have entered in this course, even after the 2 to 3 months, they consider that they are feeling inferiority complex. They may feel that I am not suitable for this course. So how it can be overcome? I will show you how to motivate themselves. This is also important. Next is the attitude to the subject, attitude to the others like the peers, colleagues, other staffs and the students, and also for the teaching. Now, tips to develop the affect. That is how you have to listen, you have to feel the sentiment, you have to try to become the part of the patient or the relatives, you have to empathize, and you have to reassure. We have to give the judgment which is safest, simple, and suits. So once anybody, some teachers, one of the teachers, they told, so once you are in a dilemma, which or what are the ideal treatment protocol for this particular patients, always think of that patient may be your brother or the sister. So in that, if your brother or sister, so then what would you do? If your brother, for your brother or sister? So again, your judgment will be easy to take. Now, the psychomotor skill. Again, we have to prepare for this. Psychomotor skill means what are this technique. This technical skill can be, you have to acquire the knowledge from different sources. We have to present. That means you can discuss this, or you have to show in your the practice in front of your peers or in front of your bosses. And we have to formulate the own statements of the rules. If you start presentation, then they will feel some problems. And again, that problems will be automatically solved during the presentation. So this practice is extremely important. You have to demonstrate in front of your peers, in front of friends, in front of the boss. And then this demonstration and return demonstration is extremely important to acquire the correct negative, to acquire the correct negative feedback, and that has to be easily corrected. And ultimately, your application will be absolutely correct. So this is also important. You may know the technique by your acquiring from the knowledge from the book, but during the implementation, you have to know what is your problem, what is your negative feedback. That has to be taken from your peers, from your friends, and also for your bosses. Now the factors requires for the better communication. You have to this communication skill, knowledge, attitude, and the position in the socio-cultural system. And you have to skill that is you have to know these encoding skill that you have how to speak and the write, how to decoding skill they have to listen and the reading, and intellectual skill that is basically it is how to perceive the knowledge, how to memorize, how to judging, and you have to abstracting the knowledge. Now the communication skill, the influential factor is the words at your these words at your command. So use the words in a judicial manner so that it will be all the for your peers and also for your for the subordinates as also for the teachers. The way you put the words, it is basically it is depending on your thinking, and whereas quality of the word what you are using that should not it should be casual, it should be thoughtful. Now re-evaluation of the self, it is important. Estimation of the interest, I already told how the interest is created, that has to be delivered by Dr. Ujjwal Devnath in the next lecture. The identification of the problem, identification of the problems, the exploration of the solution to the problems, use of the resources for solving out of the problem by efficient learning, by concentration, by persistent, well-directed work under the pressure, and the time management. And most important is the recapitulation. If you write everything in your daily diary or the weekly diary, then it will help in recapitulation of your every knowledges. And lastly, the motivation. Now, just I'm coming to the motivation. How to self motivation. So this is most important. This I already told somebody. Some students feel that I'm not fit enough, so they may feel inferior complex. So this is the I think this is the technique by which you can easily apply in every student that can apply. The be a 1 minute teacher. At the beginning of the day, always try to make some list of some finding that what to be achieved at the end of the day. So at the either in the middle of the day or at the end of the day, just make a pause, be silent for some time, and to see this is a 1 minute goal setting. Take 1 minute, only 1 minute. Take 1 minute very quiet, and take 1 minute for a few times. It may be either twice a day or maybe thrice a day, and to look at your goals and which is already set up in the early morning and see what you want to learn. So 1 minute praising, that means 1 minute you have to sit properly to check whether your goals are achieved or not. 1 minute praise, if it is already achieved, praise yourself immediately once the goal is achieved. But if it is not achieved, there is 1 minute recovery is important. In the first half minute, understand your fault, and the second half minute, you have to change your behavior for recovery. So this is extremely important, and that 1 minute teacher theory can be applied either twice a week or thrice a week. So thrice a day or twice a day or thrice a day. So it is extremely important for self-motivation. So I think this is the way by any fresh MS orthopedic students, they can motivate, they can channelize their extreme energy which is gathered once they are coming into these courses. I think I'll stop here and I'll sending over the mic to Dr. Gigi Kaur. Dr. Gigi Kaur.
Yes, I'm here. Audible or not?
We'll take questions at the end of the So I'll handing over the mic to Dr. Gigi Kaur, please.
Okay. Thank you, Ananda, for excellent disposition of the prelims. How to start a prelim. That's the ideal way, I think. Now I'm going to the my topic of discussion. That is a data record and all these things. We'll shortly start screen sharing.
Yes, this is a very, very important topic, and that has to be learned from the very day of any persons who have got admitted in the MS orthopedics or DNB orthopedics course. Because it is extremely important, that will be useful for whole of the day, whole of the years and life for those who are acting as an orthopedic surgeon.
Unfortunately, we don't have this topic included in your curriculum.
Yes.
In a written format. Textbooks do not place much importance on these, but from medical legal point of view, from your upgradation, everything, This is extremely important as denoted by Anando.
That's why from WBA we are taking initiative to make this comprehensive curriculum for the PG students.
Yes, sir. Please, you can take lead in that and so we could plan accordingly. So that every Sunday we can have one PG webinar in evening, because evening they are free, Sunday they are free.
Yes, yes.
Screen sharing is enabled, Jijida. It's enabled. So you
I
can.
think it's enabled. So it is. So you can see the whole full screen or not?
No, we can't see anything.
You cannot see.
I think first open your PowerPoint, then go in.
PowerPoint is already open. PowerPoint is on my screen, full screen actually. So I think I should take out the screen sharing and reshare.
Close, then
Close the Zoom.
no, not Zoom. Close the screen sharing.
I'm trying that, but Zoom is not responding. I'm leaving for a few seconds.
By that time, we can ask Ujjwal to start.
Yes.
Yes, sir. So there's some issues.
Dr. Devnath, do you have are you ready?
Mute now.
In the meantime, is there
A question so that we can take that.
Yes,
If
yes.
you are having any questions.
So how many questions is there?
হ্যাঁ বলুন
কোনো কোশ্চেন আছে ইউটিউবে?
ইউটিউবে কোয়েশ্চেন তো চালু করেছি, সেরকম তো এখন তো নেই।
ঠিক আছে, ঠিক আছে।
হ্যাঁ,
উজ্জ্বল দা,
please unmute, Dr. Ujjwal. Dr. Devnath, please unmute.
দুটো ডিভাইসে জয়েন করেছেন তো ওটা মুশকিল, দুটো ইকো হয়ে যাচ্ছে। স্যার একটা ডিভাইস অফ করে দেন, উজ্জ্বল দা একটা ডিভাইস অফ করে দেন। আপনার দুটো ডিভাইস থেকে লগইন আছে।
স্যার ইকো আসছে, একটাতেই করুন স্যার। হ্যাঁ,
একটাতে করলে ইকো আসবে না।
তাহলে আমি স্ক্রিন শেয়ার করে নিচ্ছি।
হ্যাঁ, জিদা এসে গেছে। হ্যাঁ,
Can you see?
আচ্ছা, এবার দেখা যাচ্ছে।
So full screen করলে everything will be
এবার এসেছে।
So the topic is very catchy, the art of record keeping and medical photography. It's a huge thing, though not given much importance till now. So we are concentrating on keeping format, and as it is for the PGTs, we are not going to the typical record keeping scenario where the hospital has to keep records for specified time, like 3 years, 5 years, and for medical legal cases, even for 10 years, 15 years. We are not going to that part. We are mostly concentrating on the PGT's requirement that you have to keep the records and the images for your own research purposes and your thesis. And further research, when you leave the institute, you become independent orthopedic surgeons, so that you can have the proper ecosystem to continue to keep records and get benefit out of that. The components of data record can be texts and numbers, still pictures, videos, and other documents such as PDF of records. Nowadays, PDF are in thing, largely replacing our handwritten documents. However, data is only important, only useful if it is organized. As you grow in orthopedic scenario, you'll find lots and lots of data in your junk in your system, like your computer, in your cloud storage, in your mobile phone. Everything becomes disorganized. So unless you have a system of organizing that data, you can have no useful information out of that. So this is not the topic for organizing data. I'm just touching this because organization is the basis of data structure. And after that, you can keep the data stored in different media and computer system. We are more in the storage scenario now. The professional medical record management systems are there for hospitals, for corporates. They are very powerful. Interfaces and ease of use vary, and we have to learn a new software, and may or may not be customizable. That depends on the software developer. It can encrypt in proprietary file types, such as difficult to pronounce file extensions. And when you are needing that, you have to go through that software only, not the other softwares, usual softwares. What we are familiar with, we can jolly well keep our records with things we are already familiar with, like MS Office programs. MS Office programs can comprise many things, but Excel, PowerPoint, and Word are three common systems we are conversant with. Then everybody knows WhatsApp, Telegram. Those are easy to share text, pictures, and videos. They are very good medium because you can collaborate, you can share with people regularly and readily. Then it comes in the processors, in and storage spaces in cloud. So there are processors in the cloud, there are storage spaces in the cloud. You can store in those also, but as we'll see later that you have to do much more than that. Photographs are the lifeline of orthopedics. Photographs without keyword tagging is extremely difficult to search for. How do you know that you have taken a photograph of such and such disease or such and such implant 3 years back or maybe 6 months back? You search through the gallery, waste your time, and come back with nonsense things. We tend to keep in folders with unique names. That's a good practice. The folders themselves can be placed in categorized folders. That is a useful way of categorizing your and storing your important information, including your photos, videos, and texts. Be very conversant with Excel. If necessary, take some courses for Excel, because this is an excellent database, excellent spreadsheet. A spreadsheet also gives you the ability for data keeping and data analysis, even the statistical analysis. All the statistical analysis for your thesis purpose can be done right on your computer, right from the Excel. Data entry here is slightly unintuitive, but you have to have a hang of that. Some other components we have sometimes used, like here PowerPoint. I have seen people using PowerPoint or equivalent software because they're very, very easy to create and edit. The text, chart, graph, image, audio, video, everything can be inserted in your PowerPoint, and keyword search is extremely easy. And as you go on with the follow-up of a particular patient, you can add images, add videos, and your handwritten notes into that PowerPoint, and it just grows. Then your mobile becomes the workhorse when you have those apps, and many of those apps are interchangeable. I mean, they can be accessed from any tablets, any mobile phones, any laptops and desktops. So across the platform, you can access this. Evernote is most popular, followed by OneNote and Dropbox Paper, because you can use images, audio, video, and text. And the audio is important because you can sometimes dictate the note and it automatically goes into Evernote or OneNote. You can use the advantage of taking annotated web pages into that. There are collaborative features. If you are developing some research paper with your colleagues, and mostly we are developing research projects with colleagues. So in those cases, these wonderful apps have collaborative features also, so that you can, from the app itself, you can go through the sub-collaboration and sharing your knowledge with the other colleagues. Now we have data. How do you preserve data? That's extremely important, because after a few years, you may lose all data. So to prevent that, this is a 21-year-old video cassette. It is preserved, but is it readable? Unfortunately, no, because the recorders, the readers are not available now. Now this is about 5 years old thing, preserved. Is it usable? No, unfortunately, it's readable, but not usable. So your data must be readable and usable too. That's why you have to have the presence of mind to update your data in usable formats in the future. Backing up is not equal to archiving. Of course, it's the beginning of archiving, but there is a difference. So you have three things. One is a medium where to store your data, method, how to store your data, and then compatibility for the future. The method comprises the schedule of backups and the storage environment. If I go to the medium, different kinds of media are available to us. Optical media largely phased out. Magnetic media, of course, they are the cornerstones like hard disks. And then electronic media are gradually seeping in. Solid state drives and the USB pen drives. Then we have cloud storage, commercial cloud storage, free commercial cloud storage, paid commercial cloud storage, and you can have your own personal Wi-Fi storage, that is a NAS drive for professionals, mainly till now because of the price factor. For those, we cannot choose one best out of those because each have their pros and cons. I'm going to elaborate a few. The capacity and cost per gigabyte of data is important. Speed of writing and reading is also important. How long the medium will last and what is the system of retrieval will last. Suppose there is a pen drive which will not be able to use if the USB system goes out of fashion. For long-term success, we store on the score, take the score, whichever is much more reliable, that gives the preference over capacity, and that goes over portability. Because the high capacity things are usually not portable. Portability of the device and portability of the data are important. External HDDs, those are the main workhorses till now. They're very cost effective, high capacity, and reasonably good read and write speed. Those are very familiar to us. Just plug and play. You don't need other softwares for those. But they have their disadvantages too, because they're very delicate and very sensitive to dropping and strong magnets. They tend to fail easily, not easily, but they tend to fail because of unknown factors, sometimes idiopathic failures, and they can fail when you need them most. Every computer users have their own paperweights made out of burned hard disks. If you use external hard disks for data keeping, please use copies in multiple hard disks. Number them properly in bold letters, and every 2 years refresh the data, because the mean time between failure of hard disks is taken to be about 5 years. Check all the hard disks with proper software first, then defragment all of them, format one hard disk, copy from another hard disk, and then repeat the process. Repeat the process for all the hard disks. This is the system where you can reasonably think about keeping the data for 20-30 years. And remember that in orthopedics, long follow-ups are often necessary, unlike many other branches of medicine. SSDs have excellent read and write speed and very reliable because they don't have moving parts, no effects on magnets, very light, portable, and capacities are nearing HDDs, but the cost is high. 8 to 10 rupees per GB now. Long-term follow-up, you don't know. There is a slight time-related decay of memory. Again, you have to have some backups. All SSDs are not alike. There are single-level cell SSDs. Those are costly, but more reliable. Then there are cheaper, but slightly less reliable version. Those are the MLs, multi-level cells. Flash drives are very easy to store because they are small. Also, they are easy to lose. The capacity is rising. Their cost per GB is around 11 nowadays, if it is about 1 TB drive. The disks are almost dead as dodos. But if we have to have, the professionals have to have very long-term data storage, then M disks are probably the solutions. But you need separate hardware for reading and writing, and they're slightly slower on the slower sides. Be paranoid. Think that everybody is conspiring against you to destroy your photos and images and videos, and that way only you can have your archiving. Use the rule of two. You are conversant with the rule of two, two joints, views, etc., etc. So go for two OS, cloud and physical. In physical, go for two OS, magnetic and electronic drives, and all those physical. Preferably, you have two locations. One is in your home and another in your girlfriend's home, like this, because one whole city can become inundated, and all the computer systems down there are chunks. So remember, it's painful to lose data. Now, you quickly go through the orthopedic photography part. Of course, it is mobile-based. Nobody uses DSLRs or prosumer cameras in operation theaters and OPDs. So it's entirely mobile-based. For the different situations, we take photographs from X-rays, CTs, MRIs, photographs from monitors, patients' clinical photos and videos, operation theater photos, photos of instruments, implants. Then we need this type of photography, sometimes close-up and macro photographies, images from the endoscopic system like your arthroscopic or endoscopies. Microphotography, rarely from pathology slides, and photography the screen in conferences, because from those photographs you can have good knowledge. For viewbox photography, many people have this kind of erratic parallelogram kind of photographs. Please keep the plane of camera parallel to the viewbox so that your picture becomes straight. Your photograph, your own picture, your own reflections, so the reflections of your camera looks bad on the photography. So the ambient light is the male conflict from here. It is difficult to capture multiple images in a single photograph. Okay, so move closer. This happens because the camera do not sense that you are capturing multiple images. They are taking the average of everything. So if you move closer, your photograph will become much more bright. And photography, one important part of the photography is focusing. So be careful about what you are focusing. From the CM, if the machine is a built-in computer, don't go for taking pictures from the monitor screen. Rather, they take the pictures with a pen drive from the hard disk itself. That can give you the best quality. From arthroscopic monitors, the same thing applies, but usually you take photographs from the screens. Here again, your parallelism of camera and screen is important. Teach that to your assistant, because you will be busy in taking, in generating the images, not taking them. And what Ananda has emphasized on, that we think in terms of epi views and coronal epi view, the coronal views or sagittal or lateral views in X-rays. Similarly, from front and from side, you have to take the photographs. This is from side, and the anesthetist is bemused about the flexion contracture, so crop him out. Operative photos, you have to train your staff, as I have already told. This is a camera shake, and the staff should avoid this kind of camera shake. Distracting backgrounds can be avoided by zooming in or can be cropped off. And now PowerPoint allows you to blur the distracting background. You can blur this area, this is background. So this area is blurred off. If you have to shoot a surgical sequence as an assistant, choose a good viewpoint, or teach your assistant to choose a good viewpoint. Start with an establishing long shot so that the audience can see where the head is, where the foot is, and so on, where the medial side is versus the lateral side. Then go closer without changing the orientation. If you have to change the viewpoint, again take an establishing shot and go from there. This is what I mean. Take an establishing shot, long shot, so you can point out this is the cephalad end, this is the caudal end, and then go closer without changing the viewpoint. That makes that takes out the spot effect. Spot effect is from the spotlight. Sometimes you have to take out the spotlight away from the operative field. But we can use the spot effect to our advantage. I'll show you. Come closer, wash any blood out, because you don't want to have your red screen. Use flash if necessary. You can use this spot effect nicely because it throws the unnecessary areas into black background. Focusing is extremely important. Out of focus pictures should be discarded. You can experiment with the angles of lighting and background so that you can choose from these three, whatever you like. I like this one most. For close-up, you must have some simple background. Light source must be at an angle to the subject for a better 3D view, and don't use flash. You can use light from another mobile phone or a table lamp if necessary. The unnecessary parts of photograph get obliterated in darkness here again. If you use implants, there are same principles that background should be plain, angled lighting, and if a reflector, white card, white paper is enough to have some light thrown in this background, thrown in this shadow. Okay. And if you go too close, don't use your flash because that will make a shine. Now, an element of scaling is necessary. This is a loose body, but you don't know how big is it. So use this scale besides this. If you don't have access to a scale, then you can use objects, dimensions of which are known to us. This number 11 scalpel is of same dimension across the world, so you can have a sense of scale here. So we have not covered many aspects of the photography like micro photography. Copyright issues, ethical and legal issues. Of course, you have to take permissions in every case, and do not post in social media unless you have express permission for that. Advance your editing. We are not going into the editing scenario here. Acquiring pictures from a scanner, downloads are from internet and uploads, but you know how to take screenshots, and screenshots can be cropped and incorporated in your database. So the last frame is that orthopedics, we orthopedicians thrive on images. Digital photography has made everything easier, yet the basics remain same. Only advantage is that you can see whatever you are taking off. Compose very carefully, avoid the background clutter. Use the light to your advantage. You can use the arthroscopic light also for some close-up photography, and exposure, focus, steadiness of your hand, rather the steadiness of the hand of your assistant are extremely important. So keep on experimenting, it's free and fun. Thank you. So I'm stopping sharing here. Over to Ujjwal.
Thank you, sir.
The last lecture, no? From Dr. Devnath, I think.
Yes, sir, the last lecture.
Good afternoon, good evening, and going to be good night very soon. So, can everybody hear me?
Yes,
Yes,
yes.
sir.
Absolutely, sir. Very well audible.
Excellent, excellent. So I thought my net was not very stable, so I had to run downstairs to my other room. I have to share my screen. So here we go. Okay. So it was excellent, Gigi and Anando, but we are running out of time now. So I will keep it short and sweet. And the topic in question is tips to select the research topic and formulation of basic research questions. Now, this is an inverted pyramid where you get a topic and at the end, you get a research question. In between, there are a few things we need to know about working knowledge on the topic and working questions, and then brainstorming to find out a research question. So this is the basis of what I'm going to speak on. So the life cycle of a research, as everybody knows, first to identify the data needs, spell out the research question from the data needs, formulate the study objectives, plan the analysis, prepare the data collection instruments, collect the data, analyze the data, draw the conclusion, and formulate the recommendations to write papers, publication, or inform your stakeholders. So this life cycle of a research is applicable to all the scientific as well as humanity as a whole. So choosing a topic is the first and the foremost important step in the research process as well as in the writing process. Choose a topic that interests you. I'm telling all the students here, all my fellow colleagues, ensure the topic is relevant, keep the topic focused, and ensure you have enough resources to support your research. So what is a research question? Well, everybody gets a thesis to write on. And first of all, the thesis is done by the mentor first and gives an idea to the student, and then the student grapples about what to do. So that's uncertainty, because this is a total uncharted territory the young orthopedic surgeon to be is delved into. And this uncertainty is something about himself as well as something about the population that the investigator wants to resolve by making measurements in the study population. So uncertainty means equates to data needs. So what you have to clarify the question, facilitate the answers, what to choose the most optimal design, identify who should be included in the study, what the outcome should be, and the outcome needs to be measured. So refining your ideas into a research question, this is the first thing about a general uncertainty about a health issue or orthopedic issue. Narrow down to a concrete researchable issue. First of all, you do a review of literature and discuss with your experts, your mentor, and you should have a thinking mind to ask the question to yourself, whether this needs, is there a gap in the research? What is missing in this work? You propose a novel approach to address the research gap and consider the potential to contribute in the field and have an impact in the society. For example, I'm just giving you a general example of how an epidemiological study can be available to us. Whether you find out about the causes of fracture spine, whether it is a good question, relevant question, or an interesting question, it may be novel, but not feasible to collect data on every case of fracture spine in the whole of West Bengal state. So if you narrow it down, what are the causes of fracture occurring in Kolkata district? It may not be feasible again because it may not be even detected. What are the causes of fracture spine attending hospitals in Kolkata district? That's more narrowing it into to collect the feasible data in alternative systems in the district. But if you narrow it down to the number of fracture spine or the admitted in a orthopedic department in all the hospitals in Kolkata district, then you find out it may be more feasible in a time frame. So if you give a time frame, you know your study is possible, but it needs a lot of planning, better methodologies, but at least you have a question which can be answered, you know. So that's how you narrow down your research topic in terms of epidemiological or observational study. Now, translating the uncertainty to research question, you frame the problem in a specific term, whether clinical or public health or basic science. You focus on one issue, as I have spoken already, is written in everyday language, common language, so that everybody understands and appreciates. Can use more than one operational verb if needed. Should link the question to the potential action that would be taken once the questionnaire answers and is stated as a question. So seek for questions from reading an article. This is my advice. Can we believe in the study? Are the results large enough or precise enough? Can they be applied to my patient? And try and question the voids in the article. So this is what we do, brainstorming the ideas. I repeat again, I'm summarizing again. Choose a topic that will enable you to read and understand the literature. Ensure the topic is manageable and the material is available in your hospital or clinical state, or even in the laboratory if you are doing a laboratory investigation or research. Make a list of keywords, be flexible, define your topic as a focused research question, and formulate the thesis statement. So here are the sources of research question. One has to have the passion about orthopedics or any science to find the question that you want to answer. You continue reading about your interest and then being alert to new ideas and techniques. You can get the ideas from reading a paper, or you can get ideas from a research meetings or conferences where you can pick up some clinical data and find this in your own practice and find it is different. Having a skeptical attitude about the prevailing beliefs, applying new techniques to old issues, these are the important things which will give you some idea about new research questions. And keeping the imagination roaming, careful observation, teaching and tenacity, and choosing a guide and a mentor who can help you to have an impact on the issue that you are going to solve. And most above all, you need a funding. So two categories of research question, a descriptive question and an analytical question. So analytical question involves comparisons, interventions to a test or a study, and descriptive is about involving observation to measure quantity. Here's an example of comparing open reduction or internal fixation in calcaneal fractures versus closed reduction and fixation. So this is where the study, you have to be careful and read in between the lines. What are they saying? Possible advantages of less invasive approaches are the lower rate of complications, shorter hospital stay, shortest time between initial admission and surgery, and possible disadvantages are less quality of reduction, worse functional outcome. So you're comparing. So comparison here is an analytical study. So this is a basic example of a study in orthopedics. So what are the steps in conceiving a research question? So as already mentioned, review of state-of-art information, raise your question, decide whether investigate by peer review, define measurable exposure and outcome, sharpen the initial question and refine the question by specifying your details. Here is an example. Outcome of unconstrained total knee replacement in severe genu more than 30 degrees in a rural hospital, West Bengal. So this research question, we want to go back to the dashboard and see what's going on in total knee replacement in varus deformity. Patients undergoing TKR in OA have good functional outcome. Patients have pain relief, which is often total, with increased walking ability and stability in more than 90% of cases. What question you're raising? Can unconstrained TKR give full functional outcome in osteoarthritis cases with severe varus deformity? Decide whether it's worth investigating, whether the level of functional outcome or pain relief is sufficient to benefit the patient's day-to-day activities. What is the optimum time required for rehabilitation? And what are the risks involved? What are the other benefits? And then define the measurable exposure and outcome. The exposure here is unconstrained total knee replacement. Outcome is functional ability and stability of knee joint following the surgery using knee society score. Now, sharpen the initial question. So how much pain relief and correction of deformity following TKR in OA patients with severe genu? This is you're sharpening it, narrowing it down, and then redefining or refine the question, specifying the details where you have the study population, operational definitions, and variables and study design. Now your question can be, how much is functional outcome of unconstrained TKR in OA? Patients are lower socioeconomic groups with severe varus who visit a rural hospital in Bengal. So these are the 6 questions which will give you an idea how you can formulate a research question and answer them. So if you follow these steps, you would be well in advance in your thoughts process of writing your research. So these are the 5 important things that one has to pass the test of a good research, whether it is feasible in your area, whether is it interesting to the people who will read it when you write it, whether it is a novel idea, confirms and refutes or extend previous findings, whether you've got ethical approval, and relevant, advanced scientific knowledge, improve practice, and influence the policy. So these are the 5 FINER, finer 5 tests, which will give you an idea of a good research. So now your statement of your hypothesis, a specific version of research question. So it summarizes main elements of study, establishes basis of test of significance, which is statistical significance, but most commonly we find clinical significance first, followed by statistical significance, because statistics is ultimately a mathematics, but your mind should be large enough to understand the clinical significance of a clinical study. Stated for analytical question with comparison groups, and purely descriptive studies do not require any hypothesis. So these are the basic differences between descriptives and analytical study. Now, I come to the Prometheus principle of studies which we research that we do. Who was Prometheus? Prometheus was a mythological person in Greek mythology who was supposed to, or who had stolen the fire from the gods and given it to the humanity in the form of knowledge and technology. So the Prometheus principle that occurs to us is from basic science research, we can go on to a solution in the clinical study. So a highly intelligent, innovative idea evolved in interdisciplinary discourse may lead to perfectly designed basic science study, which can be translated into a solution as for the patient in a clinical study. So that's the Prometheus principle which we all clinicians are working at. Characteristic of good hypothesis, it should be simple, one exposure, one outcome, specific, no ambiguity about the study participants or variables, and stated, well stated in advance, written at the outset, focused on primary objectives. So the translating the research question to objectives, you frame in scientific epidemiological terms, take the question in few limited axes, write in the scientific epidemiological language, make use of no more than one verb for each, sort as primary and secondary, and be clear about the type of question, whether it is descriptive or whether it's analytical or experimental question. So asking yourself the right question. Once again, I come to the point, two ways to deal with a poor or irrelevant research question. Try to answer it. The answer may be of no use to anyone. There may be no answer at all, but try to reframe the question. If your research question is wrong, no point going ahead and working hard on it. But if your research question is right, you have an opportunity to do a good job and write plenty of papers. There are a few questions one can try and answer, like these ones. Tendon rupture following distal radius volar plating, effectiveness of epinephrine injection and minimize bleeding, complications after treatment of flexor tendon injuries, and so forth and so on. You have multiple questions which can come to your mind. Now, here's a summary of what is required. What, why, how, where, who, and when. So what are the facts? The facts that is present to you in a literature format. What exactly do I want to achieve from that? And what do I need in order to find a solution? So you need to ask 5 whys. Why do I want to achieve a solution? That's the first question. Why do I want to do? I just want to do it for sake of writing a paper. Maybe 90% of us are thinking like that, but a thinking man who wants to do a research, they would like to know, why did the problem or opportunity arise, and why do I need to find a solution? So these questions in mind can lead you to know how we can do it, how I can find out more about it, how will the situation be different, how can I involve relevant people, and how relevant is the information I'm gathering. Where did the issue arise? And if so, why? Did it issue arise during your clinical practice? And does it have an impact if you treat somebody differently? And if so, who you are trying to please, yourself or the audience or the readers who are going to read it? Who is involved in the information? Try to find out. And when did the issue arise? When do we need to act? And when must it be resolved? So this is a summary of what is required. So these are the few queries that has led me to write multiple papers in international peer-reviewed journals from long time ago, since my first publication, which happened in 1992. So I give you some more ideas here. This is modern science, where we're dealing with the computer science methods and orthopedics into digital orthopedics. So you have multiple more thinking behind, and you can answer a lot of questions, which doesn't need any clinical thought process, but you need digital anatomical models, orthopedic surgery navigation models, and models based on finite element analysis. And you need robotic surgery, 3D printing, design of virtual surgery. These are all in the pediatric child science at the moment. So enough to develop in this, and the young minds who are more digitally practiced, they can find more answers towards this. So with these thoughts, I give you an idea where to read about this. Basic Methods Handbook for Clinical Orthopedic Research, published by Springer. That's a good book to read about the basic methods, and whether you're an orthopedic surgeon, because it is important that orthopedic surgeons do multitasking like an octopus. You have problem solving, very thinking mind, and very intelligent and hardworking like a bull. They can work day in and day out, and definitely would like to travel for your research to be spoken in different conferences. Thank you very much.
Thank you, sir. Any questions so that we can take?
In the chat box, there was a comment from Anil.
There is no question in the chat box till now. Okay.
No question, but a comment from Anirban was there.
Yes, yes.
Dr. Anirban Chatterjee is a very important point that we should take care of exposure compensation. We should know about the exposure compensation when we are taking photographs from the view box of X-ray, CT, and MRI images.
Yes, photography actually, yes, photography is extremely important for all the medical students and also the consultants also. I think we'll make a separate webinar on this.
So with your standard Android camera, you can have this kind of, you can see this. This is the standard camera, and here you can have Pro mode. There is a mode called Pro. You can see this. This is the Pro mode. Okay, this one. Food, etc. And there is a Pro mode. So if you go for this Pro mode, just touch this, and you will see various options in the bottom here. So ISO, you can adjust. You can adjust your speed. You can adjust the EV, that is the exposure value. Right now it is in the point -1. You can slide it upwards or downwards to increase or decrease your exposure value, so that your CT or image, CT or X-ray or your MRI images come nice. That can be done from the camera itself, mobile camera itself.
Okay, we'll make a separate webinar.
Workshop we can have one workshop of how to go for good photography. So it can be a replica of the 2019 IUACon.
Okay.
Okay, I think there is no question, so that we can end the meeting for today.
Yes, that is actually the beginning. So
Yes.
that we start about the preliminaries, and depending on as we have heard that there is an interest of medical photography, so we can make the next webinar on medical photography also. So I'm requesting Dr. J.J. Kaur, please be prepared, and you can give some instructions so that we can use the, like there's you are instructing that we have to open the promo and to go that. So in that case, so we have to how to take the photography of the clinical, how to take the photography of the radiography, how to photography of the CT scan, like this. You can
different scenarios.
Okay, yeah, you can do that.
Okay.
Okay, we'll discuss in the next suitable date and time. Okay, thanks to all of you, and I'm Shomodi, please, if you have any words, please give and then call up.
Okay, on behalf of WBA, I thank Professor Pal, Professor J.J. Kaur, and Professor Devnath for excellent presentation. It's an eye opener for the PG students. So I think we'll keep continuing this program.
The PG students were conspicuous by their absence. Almost.
But they can see this letter in the YouTube also, so no problem.
Letter in the YouTube, no? YouTube will be visible.
Yes, it is available in the YouTube, so that anytime anyone can check that.
That's very good.
So thank you, sir. So good night, everyone. So close for today.
Bye. Bye.
Okay.
Bye.